Yes, thank you. Thank you, Jane. I don't know if you can see my slides already on the screen with the title slide. Yes, all right. So thank you very much for inviting me to this event. I'm a professor at Université de Montréal, School of Public Health. And my work is mostly on urban environments and health, looking at how cities are being transformed and how these transformations create health or create health inequities. And so with the COVID situation in March, we started shifting our research program a little bit and have launched since then the COHESION study. I'm going to talk a little bit about that. So COHESION stands here for COVID-19 Health and Social Interaction in Neighborhoods. And this study has been launched with my colleagues, Kate Zinzer and Gregory Mulek and other collaborators across the country. Yeah. So what is COHESION? COHESION is actually a pan-Canadian cohort study that collects data in real time to evaluate the impacts of COVID-19 pandemic on social determinants of health, health outcomes, and related inequities. We have a pretty large vision and ambition about documenting the impacts of this pandemic through time. How are we doing this? We have actually set up an infrastructure that allows participants, and here we are talking about all Canadians aged 15 and up, who can log online and participate to this study. The way to participate is to sort of two options. One is to fill online questionnaires, and so we have a series of questions around health, mobility, perceptions, and so on. And participants can also download a smartphone app where we passively collect mobility data, physical activity data, as well as momentary assessment of well-being, for example. And all this data is then stored on a secured Compute Canada server database, where it's then being analyzed. And the idea with all this is to provide evidence and support decision-making for public health authorities, but also for cities and urban planners. So we just launched this study last month in June, 2 months. So what is this study about? We are looking at attitudes and practices related to COVID-19. We are looking at daily mobility and changes in social activity. We are very interested in mental health outcomes, social isolation and stigma. We're also collecting data on socio-demographics, but also food and health insecurity, household composition, and living conditions. So we're trying to get a pretty large portrait, and there is a baseline questionnaire, and then every 2 weeks we have these follow-up questionnaires, shorter follow-up questionnaires with sometimes specific themes. So for example, we are preparing a follow-up now on back to school day to better understand perceptions towards this event. Another originality of COHESION, if I can say, is that we are very interested in the spatial and social dimensions of people's lives. And so we are using a questionnaire, a map-based questionnaire. People can answer about where they go, the activity places they go to with an interactive Google Map application. And they also provide information with whom they go to these locations. So as we document the activity spaces, we also document people's in-person social interactions. And we can then link these two information together and do a number of analyses and possibly link this data, for example, to mental health outcomes. So the smartphone app, which is an optional participation, allows us to monitor more objectively mobility through GPS data collection, but also social contacts with Bluetooth information. And we also have these little questionnaires that ask about affect, daily variations in affect, in terms of well-being, but also in terms of social interactions or sleep quality, for example. So all this data, what is it for? It's really to monitor trends around all these themes over time and across space. Also, we believe that there will be, of course, a lot of variation depending on where people live, on their conditions. And then we can do a number of inferential analyses to really estimate the impact of COVID-19 and the health determinants, the conditions in which people live on health through different methods that I've listed here. One of the outputs also we are working on is to build an interactive visualization platform so that all this data becomes readily accessible for decision makers, for communities, and that this data can then serve the discussion and implementation of new solutions. This is really a pan-Canadian effort, and I want to underline and thank our network of partners. We have been partnering with a number of health authorities across the country. We have support from the Public Health Agency of Canada. And of course, we have colleagues across the country also that working with us. I see a little panel that says time. That's probably, I should wrap up here. Maybe I'm going to show a little bit of some some findings, very preliminary, but just to show you here, for example, in green, those who have mentioned that they all do all the time or often adopt the following measures. And if you look at practicing physical distancing, you see that we have really a large majority of people who either all the time or often practice physical distancing. If I go a little further, in terms of concerns, currently, how concerned are you about the following? We see that there is large levels of concerns, high levels of concerns, especially, for example, here in terms of the pandemic's impact on your community. Here we have around 75% of people who are concerned or very concerned, and then, of course, concerns in relation to senior as well as children. One interesting thing in the baseline data, we are asking prior to COVID-19, how often did you feel, for example, that you lacked companionship or that you were left out or isolated from others? And that will be, of course, of interest to see as the crisis evolves, how these numbers change. But we see that already we have a significant number of people who either often, but also some of the time, feel that they lack companionship or are left out. And finally, just to illustrate the data on the in-person interaction, here is a question that illustrates how often people in the last 7 days, how many people in their network they have met in person in the last 7 days. So we can be able to track all this information and provide interesting insights to the situation in the months to come.